What is ginkgo? Ginkgo is a large tree with fan-shaped leaves. Although ginkgo is native parts of Asia, including China, Japan, and Korea, it has been grown in Europe since around 1730 and in the United States since around 1784. Ginkgo leaf is often taken by mouth for memory disorders including Alzheimer's disease. It is also used for conditions that seem to be due to reduced blood flow in the brain, especially in older people. These conditions include memory loss, headache, ringing in the ears, vertigo, dizziness, difficulty concentrating, mood disturbances, and hearing disorders. Some people use it for other problems related to poor blood flow in the body, including leg pain when walking, claudication, and Raynaud syndrome, a painful response to cold, especially in the fingers and toes. Ginkgo leaf is also used for thinking disorders related to Lyme disease, chemotherapy, and depression. Some people use ginkgo to treat sexual performance problems. It is sometimes used to reverse the sexual performance problems that can accompany taking certain antidepressants called SSRIs. Ginkgo been used for eye problems including glaucoma, diabetic eye disease, and age-related macular degeneration, AMD, as well as attention deficit hyperactivity disorder, ADHD, autism, heart disease and heart complications, high cholesterol, premenstrual syndrome, PMS, and bloody diarrhea. Ginkgo leaf is also taken by mouth for chronic fatigue syndrome, CFS, schizophrenia, and to prevent winter depression, preventing mountain sickness and aging, controlling stomach acid, improving liver and gallbladder function, and controlling blood pressure. It is also taken by mouth to treat asthma, allergies, bronchitis, and for disorders of the central nervous system. The list of other uses of ginkgo is very long. This may be because this herb has been around for so long. Ginkgo biloba is one of the longest living tree species in the world. Ginkgo trees can live as long as 1,000 years. Using ginkgo for asthma and bronchitis was described in 2600 BC. In manufacturing, ginkgo leaf extract is used in cosmetics. In foods, roasted ginkgo seed, which has the pulp removed, is an edible delicacy in Japan and China. How does it work? Ginkgo seems to improve blood circulation, which might help the brain, eyes, ears, and legs function better. It may slow down Alzheimer's disease by interfering with changes in the brain that interfere with thinking. Ginkgo seeds contain substances that might kill the bacteria and fungi that cause infections in the body. The seeds also contain a toxin that can cause side effects like seizure and loss of consciousness. Side effects. Ginkgo leaf extract is likely safe for most people when taken by mouth in appropriate doses. It can cause some minor side effects such as stomach upset, headache, dizziness, constipation, forceful heartbeat, and allergic skin reactions. There is some concern that ginkgo leaf extract might increase the risk of liver and thyroid cancers. However, this has only occurred in animals given extremely high doses of ginkgo. There is not enough information to know if it could happen in humans. Ginkgo fruit and pulp can cause severe allergic skin reactions and irritation of mucous membranes. Ginkgo might cause an allergic reaction in people who are allergic to poison ivy, poison oak, poison sumac, mango rind, or cashew shell oil. There is some concern that ginkgo leaf extract might increase the risk of bruising and bleeding. Ginkgo thins the blood and decreases its ability to form clots. A few people taking ginkgo have had bleeding into the eye and into the brain, and excessive bleeding following surgery. Ginkgo leaf extract can cause allergic skin reactions in some people. Ginkgo leaf extract is possibly unsafe when used intravenously, short term. It has been used safely for up to 10 days. The roasted seed or crude ginkgo plant is possibly unsafe when taken by mouth. Eating more than 10 roasted seeds per day can cause difficulty breathing, weak pulse, seizures, loss of consciousness, and shock. The fresh seed is even more dangerous. Fresh seeds are poisonous and are likely unsafe. Eating fresh ginkgo seeds could cause seizures and death. There isn't enough reliable information available to know if ginkgo is safe when applied to the skin. Not enough is known about the safety of ginkgo when applied to the skin to determine if it is safe. Uses and effectiveness. Possibly effective for anxiety. Research shows that taking a specific ginkgo extract, EG 761, Dr. Wilmer Schwab Pharmaceuticals, for 4 weeks can reduce symptoms of anxiety. Mental function. Although some conflicting evidence exists, most research suggests that ginkgo can slightly improve memory, speed of thinking, and attention in healthy adults. Doses of 120 to 240 mg per day seem to be as effective as or more effective than higher doses up to 600 mg per day. Some research has investigated the effects of ginkgo when used with other supplements. Some evidence suggests that taking ginkgo in combination with Panax ginseng or Cotinopsis can improve memory better than the individual ingredients alone. However, a specific combination of ginkgo and Panax ginseng, ginkgozan, Pharmatone natural health products, does not seem to improve mood or thinking in postmenopausal women. Also, taking a specific product containing ginkgo and brahmi, Blackmore's ginkgo brahmi, does not seem to improve memory or problem-solving in healthy adults. Dementia. Some evidence shows that taking ginkgo leaf extract by mouth modestly improves symptoms of Alzheimer's, vascular, or mixed dementias. However, there are concerns that findings from many of the early ginkgo studies may not be reliable. Although most clinical trials show ginkgo helps for symptoms of Alzheimer's disease and other dementias, there are some conflicting findings, suggesting it may be hard to determine which people might benefit. Early research shows that taking a specific ginkgo leaf extract called EG 761, Dr. Wilmer Schwab Pharmaceuticals, daily for 22 to 24 weeks seems to be as effective as the drug donepezil, Aricept, for treating mild to moderate Alzheimer's disease. But, other research suggests that ginkgo leaf extract might be less effective than the conventional drugs donepezil, Aricept, and Tacrine, Cognex. While ginkgo may help treat various types of dementia, ginkgo does not appear to help prevent dementia from developing. Vision problems in people with diabetes. There is some evidence that taking ginkgo leaf extract by mouth can improve color vision in people with retinal damage caused by diabetes. Vision loss, glaucoma. Taking ginkgo leaf extract by mouth for up to 12.3 years seems to improve pre-existing damage to the visual field in some people with normal tension glaucoma. However, conflicting research shows that ginkgo does not prevent glaucoma progression when taken for only 4 weeks. Leg pain when walking due to poor blood flow, peripheral vascular disease. Some evidence shows that taking ginkgo leaf extract increases the distance people with poor blood circulation in their legs can walk without pain. Taking ginkgo might also reduce the chance of requiring surgery. However, people with this condition may need to take ginkgo for at least 24 weeks before they see improvement. Premenstrual syndrome, PMS. Taking ginkgo leaf extract by mouth seems to relieve breast tenderness and other symptoms associated with PMS when started during the 16th day of the menstrual cycle and continued until the 5th day of the following cycle. Schizophrenia. Research shows that taking ginkgo daily in addition to conventional antipsychotic medications can reduce symptoms of schizophrenia. It may also reduce adverse effects associated with the antipsychotic medication, haloperidol. A movement disorder called tardive dyskinesia. Tardive dyskinesia is a movement disorder that is caused by certain antipsychotic drugs. Research shows that taking a specific ginkgo extract, EG 761, Yinhsing, Jiang Pharmaceuticals Limited, Jiangsu, China, can reduce the severity of tardive dyskinesia symptoms in people with schizophrenia who are taking antipsychotic drugs. Vertigo and dizziness. Taking ginkgo leaf extract by mouth seems to improve symptoms of dizziness and balance disorders, possibly ineffective for age-related memory loss. Some research suggests that ginkgo leaf extract might slightly improve memory and mental function in people with age-related memory problems. But most evidence shows that taking ginkgo leaf extract by mouth does not improve memory or attention in older people with normal mental function, in those with mild mental problems, or in those with dementia and age-related memory loss. Ginkgo also does not seem to prevent age-related memory loss from developing. Sexual dysfunction caused by antidepressant drugs. Although some early research suggests that taking ginkgo leaf extract by mouth might improve sexual problems caused by antidepressant drugs, more recent research suggests it is probably not effective. Mental problems caused by chemotherapy. Research shows that taking a specific ginkgo leaf extract called Extact 761, Dr. Wilmer Schwab Pharmaceuticals, twice daily starting before the second cycle of chemotherapy and continuing until 1 month after chemotherapy treatment ends does not prevent mental problems caused by the chemotherapy in people being treated for breast cancer. High blood pressure. Research shows that taking a specific ginkgo leaf extract, Extact 761, by mouth for up to 6 years does not reduce blood pressure in older people with high blood pressure. Multiple sclerosis. Taking ginkgo leaf extract or ginkgo lib, a specific chemical found in ginkgo extract, does not improve mental function or disability in people with multiple sclerosis. Seasonal depression, seasonal affective disorder. Taking ginkgo leaf extract by mouth does not seem to prevent winter depression symptoms in people with seasonal depression. Ringing in the ears, tinnitus. Taking ginkgo leaf extract by mouth does not seem to improve ringing in the ears. Likely ineffective for heart disease. Taking a specific ginkgo extract, Extact 761, Dr. Wilmer Schwab Pharmaceuticals, does not reduce the chance of having a heart attack, chest pain, or stroke in elderly people. Insufficient evidence to rate effectiveness for age-related vision loss, age-related macular degeneration. There is some early evidence that ginkgo leaf extract might improve symptoms and distance vision in people with age-related vision loss. Hay fever, allergic rhinitis. Early research shows that applying specific eye drops, Trium, Soft, that contain ginkgo extract and hyaluronic acid 3 times daily for 1 month can reduce eye redness, swelling and discharge in people with swollen eyes due to seasonal allergies. Altitude sickness. Research on the effects of ginkgo leaf extract on altitude sickness is inconsistent. Some research suggests that taking ginkgo leaf extract can reduce altitude sickness symptoms when taken 4 days before climbing. However, other research shows that using a specific ginkgo extract, GK501, Pharmatone Natural Health Products, for 1 to 2 days before climbing does not prevent altitude sickness. Asthma. Research shows that taking 2 capsules of a specific product containing ginkgo extract, ginger, and Picorrhiza kuroa, AKL1, AKL International Limited, twice daily for 12 weeks does not improve lung function or asthma symptoms in adults with asthma. Attention Deficit Hyperactivity Disorder, ADHD. There is early evidence that a specific combination product, ADFX, CV Technologies, Canada, containing ginkgo leaf extract, in combination with American ginseng, Panax quinquefolius, might help improve ADHD symptoms such as anxiety, hyperactivity, and impulsiveness in 3 to 17-year-old children. However, other research shows that taking ginkgo extract, ginkgo tea, D. Toledero Pharmaceuticals, does not improve ADHD symptoms compared to methylphenidate, a drug used to treat ADHD, in children 6 to 14 years old. Autism. Research shows that taking a specific ginkgo extract, ginkgo tea D. Toledero Pharmaceuticals, daily for 10 weeks along with conventional medication does not improve autism symptoms in children. A lung disease called chronic obstructive pulmonary disease, COPD. Research shows that taking a specific product that contains ginkgo extract, ginger, and Picorrhiza kuroa, AKL1, AKL International Limited, twice daily for 8 weeks does not improve lung function in people with COPD. Cocaine addiction. Research suggests that taking a ginkgo leaf extract called Extrait 761 twice daily for 10 weeks does not help people with a cocaine addiction. Colorectal cancer. Early research suggests that using a specific ginkgo leaf extract, Extrait 761, ONC, intravenously, by 4, together with anti-cancer drugs might benefit people with colorectal cancer. Dyslexia. Early research suggests that taking a specific ginkgo leaf extract, Extrait 761, can help reduce dyslexia in children aged 5 to 16 years. Fibromyalgia. Early research suggests that taking specific ginkgo leaf extract tablets, Biloba, Pharma Nor, together with coenzyme Q10 capsules, Bioquinone Q10, Pharma Nor, by mouth might increase feelings of wellness and perception of overall health and reduce pain in people with fibromyalgia. Stomach cancer. Early research suggests that taking carbohydrates from the outer layer of the ginkgo fruit by mouth twice daily for 30 days might reduce tumor size in people with stomach cancer. Hearing loss. There is some early evidence that taking ginkgo might help short-term hearing loss due to unknown causes. However, many of these people recover hearing on their own. It is hard to know if ginkgo has any effect. Hemorrhoids. Early research suggests that taking a combination of ginkgo and certain conventional medications might decrease some symptoms of hemorrhoids, including bleeding and pain. Migraine. Early research shows that taking ginkgo LIB, a chemical found in ginkgo leaf extract, might help prevent migraines in children and women. Ovarian cancer. Evidence suggests that using ginkgo leaf extract is associated with a decreased risk of developing ovarian cancer. Pancreatic cancer. Early research suggests that taking a specific ginkgo leaf extract, Extrait 761, intravenously, by 4, together with anti-cancer drugs might slow the progression of pancreatic cancer in some people. Quality of life. Early evidence suggests that taking ginkgo extract, Li 1370, Lichtauer Pharma, might improve quality of life measures such as activities in daily living, mood, sleep, and alertness in older people. Radiation exposure. Early research suggests that taking a specific ginkgo leaf extract, Extrait 761, Tanacon Ipsen, might reduce some of the negative effects of radiation on the body. Skin toxicity caused by radiation. Early research suggests that applying a specific cream product, Radioskin 2, Herbalob de Peraza Massimiliano Company, that contains ginkgo extract, aloe vera, and metyl-esculatina along with another product, Radioskin 1, Herbalob de Peraza Massimiliano Company, might improve skin moisture and reduce toxicity in breast cancer patients receiving radiation treatments. Blood vessel disorder, Raynaud syndrome. Some research suggests that taking ginkgo leaf extract by mouth can decrease the number of painful attacks per week in people with a blood vessel disorder called Raynaud syndrome. However, other research suggests that ginkgo is not beneficial or is less effective than drugs such as nifedipine. Sexual dysfunction. Some research shows that taking ginkgo leaf extract daily for 8 weeks does not improve sexual function in women with sexual arousal disorder. However, taking a specific combination product containing ginkgo, ginseng, damiana, L-arginine, multivitamins, and minerals, Argan Max for women, appears to improve sexual satisfaction in women with sexual dysfunction. Stroke. There is contradictory evidence about the effectiveness of ginkgo for improving recovery in people with strokes caused by a clot. Some evidence suggests that people may improve more after a stroke when treated with ginkgo. However, other research shows no benefit. Skin discolorations, vitiligo. There is some early research that taking a specific ginkgo leaf extract, Ginkgo plus, Ceroil, might decrease the size and spread of skin lesions. High cholesterol. Hardening of the arteries, atherosclerosis. Blood clots. Thinking problems related to Lyme disease. Chronic fatigue syndrome, CFS. Bloody diarrhea. Bronchitis. Urinary problems, digestion disorders. Scabies. skin sores,